Hi, so today we're going to be sharing with you a model we developed to investigate the impact of kangaroo mother care, or better known as KMC, on infant mortality rates. So, hi, my name is Tuyen. I'm a freshman majoring in math at UF.
Hi, I'm Ziwen. I'm also a math major, freshman in University of Florida.
So let's start by defining what KMC is in our model. So we're using the definition from the World Health Organization and defines KMC as the method for caring for preterm infants who happen to be low birth weight when they were born, with a special emphasis on skin-to-skin contact it has with its mother. Skin-to-skin contact obviously is going to be the main factor we're considering, but we also want to note that there are other elements that other practitioners include in their KMC treatment, which include breastfeeding, and the time of initiation also is a main component of KMC as well.
So for this problem, we decided to build a differential model that reveals the relationship between the KMC process and the infant mortality rate. We considered several factors that may contribute to the KMC effectiveness and integrated them to a multivariable function. Besides this, the general goal of the model is to provide insights for KMC practitioners to optimize their efforts in the KMC process, thus to maximize the profit these moms or the practitioners get from using KMC treatment. So for our approach, we split KMC into three factors to contribute to the final result of it, which are breastfeeding volume the infant received, skin-to-skin contact time, and duration of KMC process also start time. For these three factors, we gather data separately, thus accessing the impact of each of them. After gathering data and finishing the regression analysis, we found out that among the three factors, there are two that are critical to the outcome after the KMC process, which are the time of initiation up until the end of the neonatal period, and the duration of the skin-to-skin contact. So next is about our assumptions. So we made several assumptions to make sure that the result of the model is valid with the data we gathered. So as shown, we assume that the population has on average a 32.6 weeks of gestational age and 1.5 kilogram birth weight. The initiation time of KMC is as 24 hours after birth. KMC term is limited to up to 28 days after birth. And we also assume uniform quality of KMC care and time as a linear effect on mortality. Also, social economic factors contribute a minimum role in our model as we assumed. In this problem, we'll interrupt KMC treatment from time between 0 and 28. And we also assume there is a normal distribution for gestational age and birth weight. Also, we assume the data we used are unbiased for that factor they represent.
So how we eventually got to our model is that we're going to consider several factors that impact the infant mortality rate, and we're going to deduce them to the main factors that we're going to include in our model. So I just want to mention some of the factors that do impact infant mortality rate. Obviously, we're not going to use all of them in our model, but I just want to point them out. The main one we're going to be using is obviously skin-to-skin contact, but also birth weight and gestational age does impact the infant mortality rate. And in our model, we're assuming that birth weight and gestational age go hand in hand, and we're just gonna simplify it to just the birth weight that we're considering. Breastfeeding also plays a role, but that's not gonna be considered in our model. And then initiation time of KMC also matters in our model. And also socioeconomic factors, but again, we said they play a very minimum role in our model. So how do these factors influence infant mortality rate? So when you have an increased length of skin-to-skin contact, the infant mortality rate tends to decrease. Also, if you initiate KMC treatment earlier on in the period, then this reduces the mortality rate for the infant. And also, it's just assumed from previous literature reviews that a longer duration of breastfeeding for the infant will obviously reduce the mortality rate. And all this has benefits to both the mother and the infant, which includes improved neurological development for the infant. It also helps decrease depression, after birth for the mother, and it establishes a closer attachment that the infant has with its mother, thus strengthening the bond between the two. It also helps the infant fight against infections better and allows them to have greater thermal control of their bodies with this KMC treatment. And all this can be very significant for low birth weight infants and premature infants because it will overall help them have a higher chance of survival. So obviously we listed the factors that we consider model, but we also want to start with a base. We also want to start with a base of how we were going to approach developing our model. So we started with the logistic differential equation because we assume that over time mortality rate will decrease with KMC, and it's going to like plateau and kind of approach zero because there's just a limit as to what the mortality rate can be. But then we realized that we had to take into the effectiveness that KMC does have a diminishing return effect. So that's why we ultimately have to account for that, and we can't just use the basic logistic function. We had to make adjustments to that to reflect the cumulative influence of past care, even when KMC is temporarily interrupted in our model. So this is our model. We're considering that the rate of change of mortality is going to be equal to K multiplied by M, and K is going to be negative because K is the rate at which mortality decrease, and M is the mortality. And we're adding that to birth weight and the function for skin-to-skin contact as a T because they overall help reduce the mortality rate. So we're adding them to make the model positive. Also for E, we're raising it to negative 0.05, which is our growth rate because we chose 0.05, negative 0.05 because we want to emphasize the effect of skin-to-skin contact, because if we make the value negative, it would have a steeper shape, which emphasizes that skin-to-skin contact plays one of the biggest roles in our model. And it also helps attain the desired shape of the sigmoid, kind of exponentially decreasing. So T is going to be in hours, which is why we had to multiply that by 24 in our model. And in our visual model, when we use MATLAB to put in our differential equation, we see that infant mortality rate does decrease over time. So it exponentially decreases. And as skin-to-skin contact, the duration increases. And then my partner will talk to you about how we obtained values for the mortality rate and the rate at which mortality decreases in our model and how we got them.
Okay, so for the constants K and M, which basically define the starting position of the function, we refers to the mortality rate data collected by the World Bank. In this scenario, M is a mortality rate constant that gives us a reference on the mortality rate level nowadays. And for this constant, we use the mortality rate of 2022, which is around 2.84% for infants. Then it's a constant K. As shown in the previous slide, K is the rate of decrease in the mortality rate at that time. So with the data set we collected from the World Bank, I made a logistic function that fits the data set and then calculate the derivative when the time is equal to 2022, which turned out to be around 706. And as in the function, it's a decay factor, so it's with a negative sign of it.
So from our model, some of the conclusions that we draw is that we can see that the infant mortality rate decreases over time as we implement the skin-to-skin contact, which is part of KMC. So KMC overall does help decrease the infant mortality rate. But from reading other literature reviews on this subject, we found that there isn't a homogeneous definition for KMC. So there's going to be a lot of variations of KMC in different studies, which can lead to different results. So we suggest that there be one universal definition for KMC in the future. In this table from the National Institute of Health in England, we can see that KMC in different studies do vary. Some only consider skin-to-skin contact, some consider skin-to-skin contact with breastfeeding, and others also include follow-up check-ins with the practitioner. So obviously KMC treatment varies a lot, so there's going to be a lot of variation. So we just do suggest in the future that there be more standardized characteristics or components of KMC for practitioners to use. Yeah, so in our model, we just want to again point out that we're using the World Health Organization definition of KMC in our model.
Yeah, and next is a conclusion and some reflections of our model itself. So about the suggestions and how to improve the variance on KMC, basically we just discussed about the underlying variables that we did not take into the discussion, like we only take into consideration of the skin-to-skin contact. Maybe there are other underlying more important factors we did not take into discussion. And also for a limitation of our model, for example, we assume taste to be constant, but actually it depends on different populations, different time period. And we also assume a linear contribution of the birth weight to the mortality rates because it can help to simplify the model a little bit and fits the reality pretty well. Also, for possible improvements, we can incorporate social economic factors by modeling KMC in underdeveloped versus developed countries. That's one example. Also, we can consider how the health of the infant's mother influence the effectiveness of KMC. Other than this, we can also consider how the volume and duration of breastfeeding and influence mortality rate.
So overall, from doing this competition, we really got a taste for what research is like in applied mathematics, and it also makes us want to pursue further research in mathematical modeling in the future. And this has been really beneficial for us to learn about how research generally works. And yeah, this is our presentation on KMC and its impact on infant mortality rate.